Hola guys, I'm Dr. Zoe and you're on the show The Legit Talks. I am so excited and so happy. Finally, this personality kind of personality I had in my list forever. Like I wanted to talk to a psychiatrist once and I had a lot of questions in my head. So I thought let's have a session with this person. I sent her the request and finally she said yes, and we have very much amazingly set questions. And I really asked to other people also, as you have seen it, I posted a story. I put a question in that, like if you have any questions to ask this guest of mine, so you can forward me. And I got pretty amazing questions, and I'm going to ask her, but soon after my questions because it's her journey. So I'm going to connect her right away. Her name is Dr. Pritisha, and amazing name of her account is The Tantrums of Amygdala. You're going to know what is amygdala and everything. She's going to tell you basically. Oh, hi Kunjan. I'm fine. How are you? Okay, so let's have a talk with her. I'll just send her the request right away, and let's all do that, guys. Yes.
Hi.
I'm so sorry.
Yes, we are back.
Yes. Oh, I'm so excited
Even I
to
am. I'm really
talk to
excited
you
for
and
today's session. Yes.
let all of my questions out on your face and like how are you going to answer me like okay, so let's have some fun with this session today. Okay, so first nobody knows you properly, so let's have your introduction.
I am Dr. Pritisha Saxena, and I am a consulting psychiatrist in Nagpur. And I have been really interested in psychiatry since, I guess, 2009. The thing
Wow.
that intrigued me was just how amazing our brain is and how amazing things it is capable of. And then later I understood that how things around us affect it and how it affects our behavior, our emotions, our basic life. And that's why I got into this. And that's why I'm a psychiatrist today. And I hope that I'm able to help a lot of people out there who are suffering from any kind of mental health disorder.
Amazing. So it's going to be a free session for everyone. Like awesome guys.
Exactly.
Just throw your questions in the comment. We are going to have so much fun today. Okay, so let me just know what is the history, like why have the psychology just came in this world, human learning humans, why there is a need of this?
So basically, if you remember, and it's still a lot of people think the same way, even in today's world, that mental illnesses have to do something with bhoot pret. And
Yeah.
this is not just common in India, it is common at too many places around the world. Basically, people with a strong history with God, with spirituality, they also believe in the demon, they believe in all the satanic practices and witchcraft and all of that. And they, a lot of times, many psychotic disorders, because that's when a person basically loses control, doesn't have
Yeah.
a perception of where they are, what they are doing. They might be hallucinating, they might be delusional, they might scream or shout. And this is just like a worst case scenario that I'm describing you. A psychotic patient or a schizophrenic patient can easily live a normal life with right treatment and with proper care. But I'm talking about the past ages where usually any kind of psychiatric help wasn't available because we never understood that this is a health problem or this is something to do with the part of a organ or something is happening in the body and that's what is causing
Yeah.
it. So it was really very early, I think in the 18th century, late 18th century, basically. And then the mid 90s, the mid 19th century is when there was a revolution where people actually understood that psychiatry is something which has to do with the human mind, not only with the organ, but that it also has an impact from the culture, the environment, their interpersonal problems, and there are a lot of things basically which affect your psyche. So since then, up till now, we have had a lot of research, a lot of things that we now know, but there are many things we are still not aware of. There are many things which actually work but are still kept. I mean, people don't believe in that. And we are still learning, still understanding what this is. And it really goes back to, I think, since humans have survived or walked on this planet. because
Yeah.
just like any other illnesses, mental illnesses were since then. But again, people used to think that this is a satanic practice and not a actual disease or disorder. And people still believe in that. So I don't know if we are still living in the past there.
Like some bits of past are everywhere. Like whatever you do, whatever is there, created here or maybe created way few years ago, but still there is a past related to it.
Yeah,
Until and unless there was a past, you cannot create anything today. So I
exactly.
really feel like it happened in a different way so that we humans started learning other
Hmm.
human brains like how to say this, how to talk like talk to a person like this, and if he's a patient of Alzheimer's, how to help that person. Like having that acknowledgement, like there is this problems happening to every other humans, so they
Hmm.
will be like okay, prepared. कि
We
ऐसा
need
करना है
we
क्या
need to know कि क्या हो रहा है and
करना है.
how to solve it, how to solve the
Being
mystery.
aware of what is happening to you, or maybe the person who is living in your house and who is close to you, and you don't know what is wrong with them, but you cannot directly judge them like, okay, they're doing it deliberately, but you just
Hmm.
have to know what is the cause behind it. So I really love this field, yeah. You are doing such a great job.
Thank
I
you.
just love you for that.
Thank you so much.
Okay, I'm sure that you have been going through sessions like almost in a week, like frequently, only a day or two
Yeah.
off, maybe for yourself. Okay, so
Sundays
uh,
off.
yeah, one day is off for you. Awesome.
Yes.
So there might be some sessions that has affected you a little on a certain level. So how do you come out of that? Like how do you handle that?
Well, I think I have a very good work-life balance because I don't really try to make my personal life affect my work or my
Hmm.
work affect my personal life. There
Yeah,
have been sessions which have been really traumatizing to hear, but once I am out of that session, I am out of that scenario or whatever we were discussing. Then only before your session, or I mean the patient, whenever they are coming for follow up, I will
yeah,
go through at least half an hour. I'll sit through their case, I'll understand, and that's when I basically go back to those emotions, those feelings that I shared with that person, because that is also important. But
yeah.
I don't know how this is. I mean, how I learned this or how I'm able to do this, because otherwise I'm a very
That's
socially
the
awkward
secret,
person.
and that's the secret.
Yeah, no, I'm actually I'm a very awkward person in real life. I cannot have small talks with people at all. You know, if
Yeah,
I meet you somewhere and I have to make a small talk to you, I'll just run away from there because I cannot do that. I just cannot do that. But it doesn't
yeah,
happen when I'm with my patients. I mean, I just don't feel anxious. I don't feel threatened. I don't feel anything. And I hope they too don't feel like that while they are in the session. So my entire focus becomes that I need to make them comfortable.
yeah.
And I think that's what exactly happens. But I don't really can pinpoint a typical session which has stayed for me for a longer time or affected me negatively, because their experiences and they are traumatic, and if I don't want to, I mean, I need to stay in good shape brain wise
Yeah.
to understand
Yeah.
what's happening with people. कोई बात नहीं. It's just my dogs, they are a little scared because
Wow.
it's thundering.
Okay, can you come to the live session, please?
So he left. So he left. He is there.
Okay.
If you can see him, he wants to go inside the
Oh,
room, and I'll open up. And this one doesn't really get scared at all. He's fine with
oh,
crackers or with anything in the world.
two dogs. I mean, you're living in a heaven, man.
Yes.
What are their
Okay.
names?
Badsha and Shiro.
So the white one is Bacha, I guess.
No, the white one is Shiro. He's the youngest.
Shiro.
And
Okay.
Badsha is 6 years old. So I'm sorry for this again. This is what's happening in
Great,
the dog
great.
house. Yes. Yeah.
Your place is nice, yeah.
Thank you.
Your place is really
We
nice.
just recently shifted in this house. Te button
Wow.
दाबून दिला. Just a minute. I'm really sorry for all this
That's fine.
commotion.
That's fine.
Yeah. Okay. All right.
Okay, so can you tell us your routine, like your basic routine, like every day?
Waking up around at 7, I guess. Taking boys on the terrace or for a walk, depending on the weather. If it's raining, it's usually the terrace. Then it's breakfast. Then we go to the clinic. At now, our clinic is under renovation, so that's some different kind of work altogether. So I'm
Okay.
not seeing a lot of patients for the past 2 weeks, and
Mm-hmm.
the renovation is under work, so that's the entire day goes over there. We come back around 3:30, and we'll be going back to the clinic again around 7 till
Okay.
9, and then
Till
around
9.
9:30 till 9:30 we come back home,
Okay.
and then eat and
For
sleep and
how
repeat.
long your therapy session stays? For how long does it stay?
For 1 hour basically. I mean, the basic is 1 hour.
Okay.
Sometimes it depends on the patient. If they want half an hour, I usually don't recommend half an hour because you really cannot discuss anything in half an hour. I mean,
Yeah, yeah.
the story doesn't end in half an hour, like whatever we are discussing. And in therapy sessions, it's usually about we discussing emotions and feelings and experiences and what things made them feel what. So
Yeah.
it's usually, we start discussing a lot of things in deep. So I usually recommend कि at least 1 घंटा बैठो, आराम से बात करो. There's no hurry, and we don't really need to rush through anything. So that's how it goes.
Everyone is so busy with work, but they are not saying that I'm busy with myself. That is
Yeah, I
that
know.
I really want to hear. It's like हाँ मैं खुद के लिए कुछ करने जाती हूँ and I like that. I stay there for like 2 hours and never get to hear it. I think
You,
like it is not as cool maybe. It's not cool at all. Like doing work for yourself.
if you say that you're busy with yourself, then people will start calling you crazy and they'll be like कि अच्छा
Yeah,
ये
it's the same.
इसको इंसानों के साथ रहना ही नहीं, घर वाले पसंद नहीं है इसको, और
Yeah,
it
it's a
is going to
typical dialogue.
start some other.
Everyone will say this. Crazy,
कोई
crazy,
और ही
crazy.
चला जाएगा सही में.
But still, like, why the psychiatry? Like you basically. People call you crazy. I mean, the field is crazy, and if there is something wrong in taking decisions or maybe facing some problems and you doing it in your own way, the people will say, "Are you mad? You need to go to a psychiatrist." Like, why would you do or say like that? It's still a wrong
Because
place to go.
first of all, because the kind of things we talk or see about psychiatric patients is usually the ones who are really out of their mind. I mean,
Yeah,
people with severe psychotic symptoms who are, or either they don't have enough IQ to lead a better life, or they have a genetic or a hereditary problem because of which they do not seem like a normal person. But this
yeah,
is a very small group of people who are usually institutionalized, or they are in the hospitals, or they are in some kind of rehabs. And I mean, that's just a very small population of people. But in
yeah.
movies, in stories, in cultural depictions of things, a crazy person is always somebody who is disheveled and has completely lost it and really
Yeah,
doesn't understand the normal things of life. But when it comes to a person who is leading a completely normal life, who has a car, who has money, who has good clothes, who has a roof, who lives in a beautiful place and has everything in the world, and भाई तुमको किस बात का दुख है?
oh yeah. Oh
तुमको
my
किस
God.
बात का दुख है भाई? So I mean, they, and because we
चाहिए क्या
lack
तुमको
science,
इतना डिमांडिंग क्यों हो तुम
we lack science to understand about the human brain. We're still working, we have progressed a lot. And ये सारे disorders physically अपन नहीं देख सकते.
हम्म
ये जो भी disorders है, इसके physical depictions क्या होंगे कि तुम lazy हो, तुम पड़े रहते हो, तुम काम नहीं करते हो, या तुमको गुस्सा आता है, तुम चिड़चिड़ करते हो, तुम्हारे को तो हमेशा शरीर में दर्द ही रहता है. So these are the physical symptoms of these disorders. बट एक्चुअल जो चीजें हो रही है उसका अपने पास अभी तक के लैब प्रेजेंटेशन नहीं है. जैसे किडनी स्टोन हो गया तो अरे वाह, उसमें दिख रहा है
yeah
स्टोन
you'll
स्टोन,
get the
डॉक्टर.
symptoms
यस, बट देर इज नो, आई मीन इतना अच्छा इमेजिंग नहीं है अभी तक के. वी हैव सिटी स्कैन्स, वी हैव एमआरआईज व्हिच शो सम काइंड ऑफ difference in activities in different parts of the body, sorry, in different parts, brain parts in a
yeah
disorder. वो ठीक है, बट दैट इज ऑल्सो अ थियोरी. इट इज नॉट अ प्रोवन फैक्ट कि आपको अगर डिप्रेशन होगा तो आपका लिम्बिक सिस्टम में ये प्रॉब्लम होगी, आपका फ्री फ्रंटल कॉर्टेक्स में भी प्रॉब्लम होगा. ऐसा वो डायग्नोस्टिक टर्म नहीं है, या वो डायग्नोसिस का एक जरिया नहीं है कि आप इस डायग्नोसिस के बेसिस पे या इस डिपिक्शन के बेसिस के ऊपर आप डायग्नोसिस दे पाओ पेशेंट को.
Right.
So we lack that as well. तो इसी वजह से आई थिंक people have such a negative view towards psychiatrists that तुम पागल हो, हमारे पेशेंट भी पागल है, और तुम ठीक है कर. I mean, I'm sorry to like say that word, but you're
But it
just,
is like for them, it is like
yeah, yes.
hello.
I mean, you're just wasting your life, just wasting your
Yeah,
life.
wasting your golden hours in something which is not at all good for you. I mean, why people say that? I don't. Okay, fine. That's something I don't want to talk about. Okay, so one general wondering, like, when do people come to you when they have a talk with you, when they share stuff? So, what part of the brain actually just starts clicking? Is like, okay, this is talking. This is really talking. I need to put everything out. What is that? Like, how do you classify this brain in like working practically, and then there is a function called as working totally emotionally and being in that moment. So, how does it work?
Okay, so if we need to diagnose a patient, so just normally whatever kind of physical examination we do for a patient, we'll start with that. That's like the basic thing that we'll do. If we are talking about typical clinical psychologic cases, psychiatric cases, I'm not discussing about counseling part because that is the next step. We are discussing
Okay.
the first step in a psychiatric clinic. So there will be physical examination, then will come mental status examination to understand that where exactly the person is. For example, we'll judge their mood, we'll judge their facial expressions, we'll look for how they are dressed. It doesn't matter if you're dressed in a Gucci Armani or a Fab India or Birdy se kharida hua some shirt. That doesn't matter. What matters is it clean? Are you buttoning it properly? Okay, is it
Yeah.
dirty? Or if you have visited me before and I know how you dress up, there's a typical way everybody dresses up. And
Yeah.
someday, for example, a girl who wears tees and shorts every day, if she someday wears a sari, everybody is going to ask her, "Be aaj sari pehen ke aayi tu?" And there is
Yeah.
no occasion. There is no occasion. If there is an occasion, that's an understood thing. And they compliment you that, okay, wow, you're looking good in a sari. But again, so for us, especially in manic cases with people who have bipolar disorder, they have, they have polarity in their symptoms. They might be depressed at some time, they might be manic sometimes. So जब depressed है तो कपड़े अच्छे से नहीं पहने होते हैं, they are just in their like घर के कपड़ों में आ जाते हैं because they cannot really take that effort to change and come to you. आ गए हैं बहुत बड़ी बात है, अगर वो फेज में वो आ रहे हैं तो because it takes a lot of willpower for them to actually come out and
Yeah.
seek help. So and then manic phase में अलग रहता है. So this is another criteria that we go into. Then we are talking about counseling when there is known interpersonal problems. So usually there is interpersonal problems ही होते हैं जो counseling में बैठते हैं लोग. Either they have troubles with their own thoughts and their own personal relationship with their own self, and then how it actually you know affects their other relationships. And it's usually a romantic relationship because I have adults who are my
Yeah.
patients. I don't really get into children because they are a different field altogether. So that's something that we focus on in counseling or in therapy, and to understand how and what of your emotions and your feelings, your negative thoughts and all of that. So a lot of times it happens that I feel that okay, if you had a fight with your partner,
Yeah.
I am feeling that something went wrong in you understanding about the situation. Now, again, I am nobody to judge that who is right, who is wrong. But I can at least help them to come to a basic term to discuss their own problems.
Yeah.
So I help them to find that thing for them. Because if that person is my friend, so I'm just going to blurt out ki it's your fault
Yeah, yeah, yeah.
without basically thinking about any other scenario. But my job is to be, the helicopter, and to take you to the helicopter as well, कि भाई अब ऊपर से देख, तू तेरा
Yeah, yeah.
प्रॉब्लम तू अच्छे से देख, एक ही डायरेक्शन में मत देख, you see it from everywhere in every aspect. Because if you are, you know effed up in your mind, your partner is
Yeah,
also, because mostly आजकल सभी को कोई ना कोई प्रॉब्लम हो रही है, एंड पैंडेमिक की वजह से a lot of things have happened with a lot of people which have
yeah,
left them in a lot of stress. And our age group is hustling and struggling age group right now, trying to figure out their life. So we
right.
are obviously under a lot of stress. तो जो तुम्हारे बाजू वाला इंसान है वो भी स्ट्रेस में है. तो if you want that relationship to work, you need to like work together. आप
Yeah, right.
आप खुद से एक एक इंसान दूसरा इंसान ऐसे झगड़े नहीं कर सकते अपन. So then this is about relationships. Then it comes about more about your own personal relationship with yourself, that what
Yeah,
you do, how you do. So I mean, your question about being that concept brain के part से आ रहा है, वो तो अलग ही साइंस है वो पूरा का पूरा, कि prefrontal cortex क्या करता है, cerebrum क्या करता है. So that is a different session actually altogether, to understand different parts of the brain and how they function and how they work. पर अपन normal basic setting में in psychiatry we don't really look into that much of one body, sorry, one brain part, because it's the
okay.
entire brain कुछ तो भी साथ में कर रहा है, वो एक अकेला पार्ट नहीं है वो. तो उस हिसाब से देखना पड़ता है उसको as a whole and not just one thing. Okay.
Okay. Okay, but this amazing name you have, the page name is Tantrums of
Yeah.
Amygdala. And I think
Thank you.
people would have this question like, what part is amygdala? So can you just tell us
So
about the history?
amygdala is a almond like small thing in your brain. Okay, it's right in the middle of your brain, and it has the job of either having fear
Mm-hmm.
or fighting. So the flight and fight response that we have known for so many years, ये यहाँ से
Yeah,
आता है. It's the amygdala's job to do that. But sometimes the amygdala misfires.
yeah,
Sometimes the amygdala feels that some problem is there. So it will tell you, hey, can you check there's a problem? I
yeah.
think there's a problem. नहीं, I'm sure there is a problem. And the amygdala goes crazy. कि problem है. And you'll be like, कोई problem नहीं है. मुझे समझ ही नहीं आ रहा problem क्या है. And when this
Yeah,
happens repeatedly, I mean, your amygdala is telling your prefrontal cortex, your limbic system, other parts of your brain that something is wrong. तो brain ultimately उस state में जा सकता है. So that's basically known as amygdala hijack. What happens? Just
okay.
a minute. I think I'll have to close all the windows. That's how much
Yeah,
it's raining outside.
yeah, it's raining here, too heavily raining.
And sorry, it's just the two of us living in the house, so everything needs to be taken care of by us. All right.
Yeah, are you comfortable?
Just a minute. Hold. Yes, I am done.
Yes. So can you like I really wanted to know like humans work such an amazing like in such amazing ways. There are a lot of superhumans I could call them like some have started industrialization, some have started an education on some different level. There are people who are doing amazingly different work and there are people who are normal, like common. And that stage, I came to know like brain has something different. Like what are the secrets? Like I just want to know hidden secrets of our brain. Please do tell me that. What else we can do? What is our potential?
I, so basically, there are so many things that are still hidden by the brain to us, like where the memory is stored, what is
Yeah.
learning, what exactly is emotions, and from where are they coming, what is intelligence. So these are
Yeah.
some questions. So we can define intelligence, and we can define emotions, we can define memory. On paper, though, we can do that, but we
Yeah.
are not able to pinpoint
Yeah.
where exactly these things are stored. For example, if you have read about the nephron in the kidney, तो अपने को पता है ये लूप ऑफ हैंडले, ये ऐसा है वैसा है,
Yeah.
यहाँ से जा रहा है वहां से जा रहा है. आई डोंट रिमेम्बर ऑल दैट राइट नाउ. but but we know what is happening there. We
Yeah.
know the receptors. We also know the receptors of the brain, but there are still questions we have no answer for yet. And I think people who are able to like achieve a lot in life and do extraordinary things, I think they have a few habits, which, I mean, this is completely my personal opinion, not a professional opinion of mine. But I guess they
Okay.
have a really sorted a way of understanding their priorities, first of all, and they do have a control on their sleep and their food intake, which are the two basic things. And in a lot of books, in books related to the mind and the brain, I've read about this. That when people are able, like monks are able to control their sleep and their food, they don't sleep like us,
Yeah.
like meditation करेंगे सोएंगे या खाना चाहिए सुबह शाम दोपहर या यही खाना चाहिए. So these are the things where our mind gets diverted into something
Mhm.
else. Like Steve Jobs always wears the same tee. I mean, you
Yeah.
just have one color. He's just going to wear
Yeah.
that. So he is basically not prioritizing what he needs to wear today, and he's
Yeah.
not wasting
Decisions.
time.
Get decisions.
जल्दी से हो जाता है. He doesn't need to
Yeah.
like spend any kind of brain energy or his other energy of the body on
Yeah.
that decision. And for people like us, ठीक है आज लाइव है, आज इसके साथ लाइव में क्या पहनूं, like. So I
Yeah.
mean,
I mean, this question
again,
was.
so this is something even I know about this because Steve Jobs ऐसे करता है, but of course I don't want to be the next Steve Jobs, so I'm not going
Yeah.
to. I'm wearing gray, but I don't want to wear gray for my life. So,
Yeah.
but again, there are people who live lavish lives, who like wear Gucci or money every day and who are earning a lot of money.
Well.
But again, what basically means calm to you or what basically means nirvana to you is your thing. It's not
Yeah.
कि पहाड़ों में जाके ही मिलता है.
No. 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 No.
So again,
It can
your
be
your
anywhere
perception,
possible. It can be
yeah.
anywhere.
So secrets of the brain तो अभी भी secret ही है अपने से. And the basic secret of the brain, which is not a secret, and everybody's experienced it, that our brain has a negative bias. It
Yeah.
will always keep thinking of the negative, traumatic things that have happened with them, that they have seen, or they have experienced, or the kind of thoughts that they have.
Mm-hmm.
तो अपना वो नेगेटिव बायस लूप में ही जाता है, उसको नेगेटिविटी ही पसंद आती है कॉमनली. So to train your brain to like move towards being towards a little positive side and basically thinking in a direction whether when you are not thinking of failure all the time. So that is a challenge that there is no simple solution to it कि ऐसा कर लो तो हो जाएगा. अगर ऐसा होता तो everybody would have been like successful.
Yeah.
It's a consistent journey. It's an easy journey, but it needs to be consistent if you want to train your brain like that, where you are just not focusing on the negative. So
Okay.
I
So
think,
the thing is, you need to
yeah,
find your own secrets along the way. So when you experience things or when happens to you something wrong, so how do you take it? That's the biggest secret. And if you find like, okay, ये situation को मैं संभाल सकती हूँ and I'm not going to overreact on it, that's a bigger
exactly,
successful that point.
exactly. I
So
mean,
you are
is it
basically, yeah,
worth it? I mean, is it worth my attention? Is it worth
yeah,
me
yeah.
spending so much time on it? कि ठीक है मेरे को
Mm-hmm.
आज किसी ने ऐसा कुछ बोल दिया. Should I actually focus on that, or should I really bother about what they have said to me? It really doesn't
Yeah,
matter.
true, true, true. Okay, so this generational traumas is one of the topic that keeps on coming in my head. So whatever the humans are today, they are just because uh, they have surrounded themselves with such people, or maybe they have been listening to them, or maybe they are experiencing some things with these people itself, or maybe you are just uh, having those people around you and have that thinking, okay, ye mere sath hi ho raha hai, or something like that. So I have seen a pattern, like generation to generation, there are some ethics or values which are passed on. Okay, so can you tell me, like, what can be the biggest disadvantage of having something really dark and in the name of generational traumas only? So, can you just tell me in brief generational traumas?
I think the biggest generational trauma that I can think of, I don't know if it's a generational trauma, but how women have, I mean, what they experience after their reproductive age starts.
Yeah, yeah,
So, I mean, that is something which is common in Indian societies,
yeah,
in some other places as well. I
yeah.
haven't studied about them, but I know about India. And because
Hmm.
of these patterns and these thought processes, a lot of women shy away from having a healthy sexual relationship as well. Because number
Yeah,
one, they are not aware of their body. When they think
yeah,
of periods, they think of dirt, they think of being
yeah,
filthy or dirty or just somebody who should be, dur rahe, don't enter the temple, don't enter the kitchen, and all that shit. And for a lot of people, maybe who are privileged enough, this might not be an issue. But this issue still persists, irrespective of your education, of your background.
yeah,
It's still there, and it's really hard to break. And I see a lot of change. At least when I was a kid, and when we see about it now, there's all these things have really changed. But for a very few, very few people, it has changed. And to like vast majority of the population out there, this is still common. And this basically leaves you to what? I mean, what is your life worth? I mean, I'm not saying that only sexual pleasures are something that a girl should look forward to, but that is also an enjoyable, pleasurable part of your life, which you should be okay with. And the thing that these girls are not okay with their own body organs and how they look, and when they have their periods, they feel completely out of place. And I don't think that's how it should be. I mean, it's a normal thing. It's something which because of which there is life. So
yeah,
that shouldn't be a problem. That this is I mean, this is something dirty. But then there are some cultures who celebrate a woman menstruating for the first time.
yeah,
There are cultures worldwide who do that, and that also makes us see how they visualize or how they live their life differently from these girls. So we
yeah,
do have that information already when we make these things okay, how it changes and what kind of things their females are doing who don't really think of themselves as dirty when they're on their periods. So I think that's one thing that came into my mind right now, when
but there
we
are
are
a lot of
discussing
things.
about.
Yeah,
Yeah, there are a lot of things. There are endless things about this. I mean, there's marriage. There is how men are always forced to work, and they need to earn, and they need to be the provider of the family. That's a different problem altogether. Like if women are made to are made to take care of everybody in the house by physically laboring, men are also made to physically labor and earn money as well. And then if they
yeah,
are not able to earn money, their their entire I mean laboring goes to the drain because you're not
yeah.
earning enough for the family, and that's the only job that you have. So these things, I mean, the thing that we have generalized, uh, our duties as a woman or as a man has basically created a lot of problem than solved. That it's okay if the
From
woman
what
is
time,
working.
like, it has been stated in the world, like, women's are only supposed to do it? I mean, and if it comes to a men who are actually enjoying their life, but not working in the kitchen and not doing that extra work that we are supposed to do, still they are like, okay, why we need to do it? It's your job, and they have no even thoughts about it before saying like, okay, थोड़ा सोच के बोलो what that person might think, and they are not meant to be here working extra hours, also working on themselves, but also working for other people. It's not only their responsibility. So what step we can take actually to tell these people like, okay, dude, it's your job too. So if you need your own clothes, you need to go and iron it or maybe wash it. Because it's your clothes. You have to do it all by yourself. If we are doing it for ourselves, we need to do it also the same. Also, there are survival techniques that every girl knows. Like if we go out, we need to have some utensils with us. We need to cook and eat something. And also, cooking is one of the most surviving this main skill, and no men know it because they're always sure like अगे अपने पास है ना कोई वो बना के खिला देगी या कर लेगी हमारे लिए सब कुछ. So how do we need to bring this change? Like tell people like your job.
Well, I think like we were talking about how things have changed in 18th and 19th century for psychiatry. If we remember about the war period which we had, so basically
Yeah,
there was just war before all this. There were
yeah,
war after war after war, people conquering each other's lands and doing all that
yeah,
crazy things. That time, on the field, there were men because women they were either pregnant or
yeah,
they were either having a baby or they had to take care of such other women who were going through other issues as well. And
yeah,
men were more obviously having more physical energy or more physical things, or we can say that they are physically more powerful than we are because they
yeah,
had a big physique than a woman's physique. And if we think about war and fighting, there's usually men who have had fought wars, but there have been women as well. We cannot miss out Jhansi ki Rani on this, that
yeah,
she
yeah,
was carrying a baby and then she was also fighting on a horse. So, but majorly, because there was actual physical labor was involved everywhere. Either they were fighting in a war, or they were constructing something, or they were working, and there was a lot of manual labor. There was no
yeah,
machines, there
yeah.
were no technology back
Nothing.
then to carry out these things easily. And even if they had technology, like we feel that there were technology before, who have carved like a stone into a temple, if there was good technology, वो good technology को चलाने के लिए you need good brains, you need people
Yeah,
again. So there were not only men, but of course there might be women as well. But majorly women used to stay at home. Now, if you go back at your own place, at your own relative's house, there will be the woman of the house who is going to, tell the daughter कि ऐसा
yeah.
करना चाहिए. The man of the house is never going to bring
No,
that
no,
for
no.
you unless the man also has that kind of job or that kind of I mean, if he's actually interested into telling his daughter that तुमको तो बड़े होने के बाद कुछ और करना है नहीं, and then there are
Yeah,
again such men. तो एक सिंगल पार्ट है ही नहीं इसमें, ना इतनी सारी चीजें इन्वॉल्व हो जाती है एक साथ. And maybe because of that, because of how women treat women have treated women have been the core reason of bringing down women for generations, who actually are the ones who bury a girl child, a live girl child, or who will curse their daughter-in-law to be in a certain way. And that still persists. And this is not just common for like mother-in-laws, this is also common for mothers as well to do that.
yeah.
That they will ask their girls to like, ladki ke jaise bed, or you are a girl and
It
what do
actually is
you, why
defined
do
to
you
every
have such,
human on this earth.
yeah. I mean, if
Everybody
somebody
knows girls
wants
actually.
to get a tattoo, the mother of the house will always going to come up and say कि तेरे से फिर शादी कौन करेगा.
Yeah.
I mean, recently we had two girls walk into our clinic for a tattoo removal because they were going to get married.
What?
And I was like,
How does it even
I thought
matter?
the, and those tattoos were like छोटे छोटे प्यारे प्यारे tattoos in a place which is hidden.
Yeah.
Why do you need to? And if the one girl had a tattoo over here, it had written
Mm-hmm.
"Daddy's Little Princess" with a heart.
Yeah.
So the guy was like, "कि वो मत हटा, but heart हटा दे."
What?
And I was like, this girl is also doing it. I mean, I'll do it for her. But then I asked her if she wants to do it because as I have a lot of tattoos, I know that while the tattoo artist always asks me if I actually want to get a tattoo. So even before
Yeah.
removal, we ask the patients to, are you completely sure? If you're 100%, I mean, you go home, you think about it again. We are waiting here. The machine is here. You think about it. If it's your decision, because then if it's not your decision, if it's a haste decision कि अभी इसके साथ मेरा झगड़ा हुआ अब इसको प्रूफ करने के लिए मैं टैटू निकाल दूंगी. So and we haven't heard from that girl yet. I mean, she said that she was pretty okay. कि ठीक है, like give me some time to think about it. And
What? Dude,
I
it's your
mean,
body. It's your
yeah,
decision. How?
girls as well give in, they cave in these situations. So I cannot pinpoint or blame any one person or any one generation for this. सबका involvement है इसमें. Everybody is involved into making this a scenario normal.
I would really say that all of these issues like always happens with girls, and I can see a boy standing up and saying, "Dude, I have this problem with these people. This society is not letting me do such stuff." And I was like, I want to see that.
Yeah,
What to do? Okay,
because if some guy actually does that, he will also be
yeah.
called. He will be called out. He will be called out because men are also given certain responsibilities by the society.
Most of our responsibilities are only given to men.
No, there are responsibilities just like girls have these responsibilities of घर संभालना है, पति को संभालना
Yeah.
है, तुम्हारे करियर को तुम जला डालो, खत्म कर दो उसको. Men are like, you forget about your dreams and your passions. All you need to
Yeah.
do is get a good job or start your business, a good business, earn good money, अपनी बीवी को ऐसे रखो, अपने माँ बाप को कब पहली बार प्लेन में बिठा के उड़ाने लेके जाओ,
Yeah.
घुमाने लेके जाओ. And again, there are men who are not interested into working in just in engineering or just doing IIT or just becoming a doctor. There
Yeah.
are a lot of people who don't want to do that, but because they don't have a choice, and ये हमारे घर का राजा बेटा है, तो राजा बेटा को भी perfect रहना पड़ेगा. Because if he thinks कि I want to like chill and like given a year or two to him to think into what I have to do. So it's not easy for men and women. मतलब दोनों के अपने अपने अलग ही problems create करके रखे हुए इन लोगों ने. And anybody who tries to break this drama or exit the drama, they will be called on. They will be called out, irrespective of their gender.
So basically, there should be a balance, and also this healthy stuff to do is to just talk to yourself. Like brain से कोई बात ही नहीं करता है. Everything is getting done there and there itself.
Yeah.
We don't get time to ourselves. We don't do the things that we like. And ठीक है, job important है, business भी important है, but you are important. If you're not healthy, how these two things are going to work anyways? Your home and then your professional life, and how are you going to handle that? So for that, इसको healthy रखना जरूरी है. So going to a psychiatrist and having a therapy or getting a therapy done is not a wrong decision. Guys, please, I mean, इस चीज को दिमाग से निकाल लो कि अगर हम लोग कोई साइकाइट्रिस्ट के पास थेरेपी लेने जाते हैं, इसका मतलब ये डिक्लेयर नहीं हो जाता है कि तुम स्टूपिड हो, पागल हो, या फिर तुम्हारा दिमाग काम नहीं कर रहा है. The thing is, sometimes when you do this meditation thing, na, that is also the wiring thing. Like you're actually getting yourself wired again and coming back to the reality. Okay, not going into the wishful thinking. So now coming to the wishful thinking topic, can you tell me how does it harm our brain? Wishful thinking.
So what exactly do you mean by wishful thinking?
I mean, like there are things which are already false in the world, but for us it
Hmm.
is true. It is for like I believe it, so it is there. This is wishful thinking. So what does it harm? Like how does it harm in that person's life? Because that person's perspective is totally different. He thinks everything in his own way, which is not even possible. Sometimes if you say that, okay, apple is red, For us, apple is red. For but that person, wishful thinking, no, I can see that's not an apple, that's a banana. Just like looking at the situation in his own way. Like, उसके दिमाग में वो fit. This is wishful
Okay.
thinking. So can you tell me how does it harm in that person?
Well, the only kind of harm this kind of thinking will do is into how society is going to perceive this person as well.
Yeah,
Because if a person is calling a banana an apple and a banana, that basically means that there something is distorted. Because an
yeah,
apple will be an apple, a banana will be a banana. So either you can be delusional, or you might be hallucinating, or if you see color green instead of red, that means you might be
yeah,
colorblind. So this comes under how you are perceiving things, and there is a limit to it as well. So there is something known as concrete thinking. Concrete
yeah,
thinking में क्या होता है कि you are I mean, if somebody says, like, there are people having dinner or lunch, this is an Indian family, and a person asks कि बेटा उनको थोड़ा परोस दो, या उनको बोलो उनके प्लेट में सब खत्म हो गया है, कुछ खा लेंगे, मतलब कुछ दो उनको. And he asks कि अंकल कुछ चाहिए क्या, and the uncle says no, and then the guy sits down कि उनको तो कुछ चाहिए नहीं, and then he starts eating his food.
yeah.
So now this can be taken as a rebuke or as something disrespectful, that तुमने
Yeah.
दोबारा पूछा भी नहीं. अरे क्यों पूछे, सामने वाले ने
Why?
मना कर दिया. चाहिए होता तो हाँ दे, या वो खुद ले लेंगे या खुद मांग लेंगे. So this
Yeah,
is won't exactly come under again concrete thinking if we actually think how logical this is. I mean, I
yeah.
don't find people forcing me to eat food. I'll eat food, man. I'll eat it. Don't worry. I am a foodie. I'm going to eat it. But if you like keep forcing me, I'll not be able to enjoy my food. So
But
don't
people
force
like
me.
the family says ना कि ये तो हमारा
Yeah.
ट्रेडिशन यार हम लोग तो ये फॉलो करते हैं ये जरूरी है एंड इफ
Yes.
यू कम एट होम यू हैव टू हैव दिस फुल प्लेट ऑफ दिस मच भरा हुआ फूड विच इज फाइन इफ इट गोज टू वेस्ट दैट इज फाइन goes in a
Hmm.
waste that is not a problem for them but the problem is you didn't tell them or ask them the second time or the third time please do क्या please ले लीजिए why are you forcing why do you call it as a tradition I don't understand
So again, that's the perspective of that particular culture. Not
yeah
every family or every cultural family that you go into, they're going to force you. There's usually food on the table.
hmm
In my house, nobody used to force each other. But I've seen normal households like Pati Patni and Bache, the
yeah
Patnis forcing or khalona or khalona, because she has to force her husband, she has to feed her husband. ये उसके दिमाग में feeded है by her mother, by her relatives, by people living around her. But then for a family, it's like कि यार सब अपना अपना देख लो, ले लो, खाना बना हुआ है, खा लो अपना अपना खाना, सब साथ में बैठ के खाते, but self serving कर लो. So
yeah
so
But
basically
there are some
again,
people, yeah, Pritisha, they what they do is they on purpose they don't take that food much because उनको पता है कि आगे वाला person उनको वापस एक बार पूछने वाला है.
yes, yes, that comes
You,
on
I
the
think you
other.
know these people.
Yes, so that's going to come from the same thing कि दो बार पूछते ही है ना, दूसरी बार जब पूछेंगे तब मैं मांग लूंगा.
हमारे यहाँ तो पूछते हैं तुमने क्यों नहीं पूछा पूछो
पूछना चाहिए ना, दूसरी बार
यार
पूछा भी नहीं, एक बार मैंने उसको मना क्या कर दिया तो वो बैठ ही गया, उससे दोबारा
yeah
पूछा भी
I
नहीं.
hear this thing like from so many people I'm like भाई अगर तुमको नहीं चाहिए तो मैं force क्यों करूँ this is common sense. Okay, that is
Exactly.
that's totally a thing like people follow nowadays. That is fine. That's okay. Okay, so I have asked few of like on my Instagram account. I posted a story. Like I said, like if you have any questions, I'm going to talk to a psychiatrist. So please welcome your questions. I've got a lot of questions, but let's just cut it short, and I'll find few more better questions to just totally focus on. One person, her name is Kunjal. She is a me. Her question is how to take decisions fast and how, as so many people can't select what they should do.
So if you're not able to take decisions fast, that means you're undecisive, like indecisive. Either you feel that your decisions are wrong, or
Mhm.
you have too many decisions in front of you. So first of all, you need to like limit your options. When we were discussing about Steve Jobs thing that he just wears
Yeah,
one color t-shirt every day. So he has limited options for that. So he's going to pick up from there. But if your anxiety is playing a role in your decision making, that means you need to address why you have that anxiety, work on that anxiety to actually start trusting yourself.
Yeah.
बिकॉज डिसीजन नहीं ले रहे हो इसका मतलब है आपको खुद पे भरोसा नहीं है कि यू माइट एंड अप in a bad place after taking such decision, and you might end up getting hurt, or you might end up losing a good opportunity at work by this decision. So basically self trust है ही नहीं अपने पास,
Yeah.
या फिर आपकी एंजाइटी है जो आपको बोल रही है कि ये गलत है, वो भी गलत है, तू गलत है, सब कुछ गलत है, तू बेकार है, and that's what your anxiety is talking to you about. Or a lot of times people who have depression also are very indecisive because they are confused as to what exactly they feel. A lot of times when the first question, if I'm asking them, or the first time when I ask a patient to describe their depressive feeling, so
Yeah.
they'll mumble something, and they'll be like, I exactly don't know what words to put to explain it to you that how I'm feeling, because that is such an overwhelming feeling. It's such a confusing
Yeah.
feeling. And especially it is seen people with depressive symptoms, not necessary that you might have the disorder, but symptoms, depressive symptoms or anxious symptoms, or if you have some style of anxious attachment to people.
Yeah.
So that again has some kind of low self-esteem attached to it, distrust or mistrust in yourself and other people as well. And you might relate your future to the past, and you basically forget to live in the present. So you're always
Yeah.
in the
That's
past
the thing
thinking about,
everyone is doing here. Like no one is thinking what is happening in the present. They are living in the past or maybe living in the far too future. Like अच्छा ये करना है, ये होने
totally.
वाला है. Then there are people who would say like यार ये तो हो गया, अब मैं क्या करूँ, and still crying over those things. Like actually people को सिर्फ इतना जानना जरूरी है कि live in the present moment. Past is already gone. Future is I don't know. वो उधर है कहीं ना कहीं है, but तुमको दिख थोड़ी रहा है. Nothing is in hand except the present moment. So that's right. Like, okay, whatever decisions you want to take, be in the present moment and just find shortlisted options in your head so that you can just quickly, okay, this is perfect for me and I should just. I was also one of the person who would like, अच्छा ये चाहिए या ऐसा करना चाहिए. Like, why too much thinking and so much energy wasted into that? So better like,
Basically, we start to try to foresee the future
yeah,
in such scenarios. We try to like fortune tell our own life, which कितना
yeah,
भी कर लेंगे वो possible ही नहीं है. I mean, I really don't know what is in store for me when I end up in my clinic at 7:30 today. I don't know what's going to happen, and something might surprise me, or it will be just a normal mundane type of situation, nothing interesting. And even if I keep thinking कि okay किस चीज के लिए मैंने prepared रहना चाहिए, क्या कारपेंटर का कुछ हो गया होगा, like I told you there was some work going on there. So
yeah,
even if I try to get prepared, my anxiety will try to make me prepared. You need to like figure out if this happens, what will you do? If that happens, what will you do? And when we are thinking of decision, taking some kind of decision, we always try to then understand okay, समझो I take this admission, I'm going in for this job either. And what if my employees, my like colleagues or my employer is not good, or if something happens with my employer, if I fight with them, or if something else happens, how will I manage that? You get stuck in that imaginary situation, which is because of
right,
your anxiety. And we basically need to understand the root cause of this, that why is this happening to you? Because
yeah,
थोड़ा सा तो अपन ऊपर ऊपर से ठीक तो हो ही जाओगे फटाक से. Not a very solution like going out with friends and doing this and self care work till a limit. They definitely work, but once that is not satisfying your need or giving you result, you need to go in for a professional help or something which is going to help you out, who knows about this stuff basically, who knows how to deal, basically understand these kind of situations. So that's
So
about
can
it.
you hear me
Yeah,
clearly? Because
yes,
I can't.
I can hear you and I can see you as well.
Yeah. Okay. So we are back. This is like really informative one, and I think Kunjal has been totally enlightened with this answer. I hope she can understand what is
I,
what is
I
so
hope I like answered her
yeah.
question well.
Yeah. Okay, so there is a friend of mine. Her name is Kapila, and it's her birthday today. Happy
Oh,
birthday to
happy birthday to
Kapila.
her.
Yeah. So her question is, what to do if you are in an anxious attachment and you are unable to change your style?
Okay. We were discussing about anxiety, and a
Yeah.
great leading question after that. In anxious attachment or with toxic relationships, basically, we always try to find a safe place.
Yeah.
And the safe place is something which you already know how it works.
Yeah.
You don't want to experiment with something. You are comfortable with that environment that you're already familiar with, or you already know कि इसका outcome क्या होने वाला है. For example, if you're with a toxic person, either they are abusive in a way, or they might be cheating on you, or there can be 100 other reasons why the person is a toxic person to you. Maybe mistreats you, or has other sets of problems altogether. And you know that. I mean, the partner knows about it. This is the issue, and this is how
Yeah.
he is or she is. So it gets comfortable with that entire perspective, because again, to leave that toxic person behind, you will need to basically do something very new, very uncomfortable, something where you might have to confront them, or you will need to talk, or you will have a fight, and these events are very disturbing. You already know that this is going to really take a lot of your energy and a lot of will to get out of that mess.
Yeah.
So we already lack energy because of our anxious attachment. We are already like laid back, reserve पे आ गई है गाड़ी. And if you try to like push the throttle more, तो भड़ाक से खत्म हो जाएगा सब कुछ, जल जाएगा
Yeah.
पूरा पेट्रोल, and you'll be left with nothing. So refueling करना पड़ेगा पहले, and to understand that why it is important for you to leave, and that it's completely okay, and it's actually a better peaceful world out there without a partner, at least without a partner who is toxic to you. And no matter
True.
what happens, if you are the person who you trust the most, who you like the most, who you have the best relationship with, you will not seek a partner just for their external features. When you have a
Yeah.
partner, it's not because you need them, it's because you want to be with them. वो बहुत बड़ा डिफरेंस आ जाता है इन रिलेशनशिप.
Yeah.
Because when you need a person, that means you are trying to fulfill your own gaps with somebody else, which जैसे कोई पार्टनर का फुलफिल कोई यू कैन नॉट फुलफिल a partner's need by your own self. I mean, for
Yeah.
example,
Yeah.
I have Shiro in my life. A giraffe wouldn't have like solved a purpose. I will need Shiro. I want Shiro.
Yeah.
Similarly, if you are filling that gap, तभी problem होगी. So being in a good relationship with yourself first before jumping कि I need a partner or I need to get married because I cannot be alone is basically you're pushing yourself into a toxic relationship. Maybe
Yeah.
that person might not end up being toxic, but you can be. So,
Right.
and you don't want to be toxic to anyone. So we need to work on our relationships, the relationship that we share with ourselves before
Right.
indulging into something else. I think
Correct.
I just went ahead with the topic, but yes,
No, but it's perfectly explained. Like she could understand like what lacunas are there inside, and we don't even know about them. We just
yeah,
keep on saying things, and also, अगर तुम बोल भी रहे हो आगे वाले को person को कि do not expect, but you are also doing the same thing.
hmm,
You are also expecting from them. Like
Yeah.
शायद किसी टाइम पे वो ऐसा बिहेव करे या फिर तुमने ये करना चाहिए था वो करना चाहिए था. It's not supposed to be like that. Everyone is free of their own decisions and वो अपने हिसाब से रह सकते हैं. So
Yeah.
next question from her itself comes is like, why do we search love in our partners and that that love that we do not get from our parents? I mean, now this is like going to a generational stuff, I guess.
Yeah,
So
because
that's the
whatever you
question.
lack in childhood, whatever things you feel again are missing in your childhood, especially coming from your parents, you usually want them to be fulfilled somehow. And then you
Yeah,
try to find those things in your partner. So again, if this childhood trauma is not resolved, you can get into a loop of toxic relationships where you always have a toxic or a bad relationship with a lot of people out there. मतलब
yeah,
एक इंसान बुरा निकला उसके बाद दूसरा इंसान ने भी कुछ तो भी किया because you expect something which the partner cannot give you,
yeah,
and that expectation can lead to fights and issues and problems in our life. So basic चीजें अगर normally see what exactly a human needs love, care and attention. तुम उनको ये तीन चीजें अगर दे दोगे अच्छे से और उनको एक सेफ स्पेस दे दोगे तुम्हारे घर के अंदर, तो नो चाइल्ड विल ट्राई टू सीक these pleasures outside. These simple pleasures, then they turn out to seek it in a way where they actually think of a romantic sexual relationship.
yeah,
Because ये feelings बड़े होने के बाद वैसी बनती है. And
true.
we feel that intimacy, a sexual intimacy will only give me pleasure because उसी से मेरे को ठीक लग रहा है. So if a child has been neglected, if a child has been traumatized, if a child have had really bad memories from their childhood, so it does affect in what kind of relationships they seek.
Right.
And if you perfectly had a good life, if you, I mean, there are a lot of couples who have, I mean, good families as well, and they have like they are also sorted. They don't have all these problems with their family or with the society. They're pretty chill with the society. They end up with partners being okay with the society as well, being okay with whatever is going on, and they have no issues. And there are such people as well.
Yeah,
But then there are people who do not like all these things. That ये कहाँ से क्यों चल रहा है, क्यों हो रहा है. And the thing that when we are children, our parents never thought of us to be an individual person. We are thought to be children without any problems, without any issues. But as far as I can remember, I always had problems and issues. Even as a kid, either it was in kindergarten or it was in first standard or हर time पे there was some kind of stress. Either
yeah.
कॉपी कंप्लीट नहीं होती थी या प्रोजेक्ट कंप्लीट नहीं हुआ होता था या मैं कोई कॉपी ले जाना भूल जाती थी. एंड
Mm-hmm.
दैट यूज्ड टू बी उस टाइम का सबसे बड़ा प्रॉब्लम एंड द
Yeah,
प्रॉब्लम ऑफ माय लाइफ. And these problems have just grown over the period of time. And if a child doesn't learn how to manage stress during these times and how to cope up, it basically keeps growing into bigger problems with more bigger solutions. तो आप जितने जल्दी इंटरवेंशन करोगे या जितने जल्दी उस चीज को बदलने की कोशिश करोगे उतना कम टाइम आपको देना पड़ेगा थोड़ा सा रीसेट करने के लिए खुद को या समझने के लिए. नॉट इवन रीसेट इज नॉट द करेक्ट टर्म टू यूज बट हाउ टू basically come to terms with your own self or how to
yeah,
cope better or manage your stress better in daily life.
yeah. So one of the questions is related to this thing only, like how to love your dad if he's toxic, narcissist, control freak, and how to heal from all the traumas he caused.
Okay, if your dad is toxic or narcissistic, I mean, it's completely up to you. I mean, it's not important for you to love a person because they are your parent. So it's okay
Right.
if you have some feelings of dislike or hate or negative feelings towards them. So that's completely okay. I mean, you're not obliged to love your father just because he's your father.
Yeah, right.
So it is okay if you have negative feelings because that has affected you somehow. And we just cannot keep that at bay. Keep this, for example, if a person has, say, they have diabetes, okay, and if the question was, I'm just reframing a question in a different way. Why
Mm-hmm.
does my dad need to? I mean, my dad was diagnosed with diabetes, but I don't really like them taking the medications. How do I stop him from taking the medications? I don't want his kidney to be affected.
Yeah.
First of all, kidneys तो already affected है because he has diabetes.
Yeah.
तो वो मैंने चलो liver affect नहीं होना चाहिए उनका दवाइयों से. I'll change the question a little bit. So यहाँ पे it's okay. Your father has a problem or disorder, a diagnosable disorder, and you and okay, let's frame the question this way that he has diabetes, but and I make delicious desserts and I have like a dessert shop or a bakery, and I am unable to give whatever I cook for him to
Yeah.
enjoy that. I think this is a better question to frame for that for her question. So,
Yeah.
because he has diabetes, you already know that you cannot give, particularly give him the sweets. But yes, you can show that you make those sweets and that you want to do something or you make something जो वो diabetes वाला इंसान भी खा सकेगा. Similarly, when you are trying to love a father who is toxic or narcissistic, you first of all you shouldn't have any kind of real abuse from him, any kind
Yeah.
of physical abuse and all that. That's a very different thing altogether, way too personal. But you can find your ways to be okay with how he is and accept him basically, because usually a narcissistic personality or these personality disorders are just to for us to understand the person better.
Yeah.
But people don't really go for therapy. I mean, if she asks her father कि आप therapy में जाओ, वो नहीं जाने वाले. उनको सब bullshit लगने वाला है because they don't feel that they need therapy. And I
Yeah.
think that's okay because these people are like conditioned in that way. ये उनका setting ही वैसा होता है. आप setting को बदल नहीं सकते. आप personality disorders को completely change नहीं कर सकते. So that is their personality and that's going to remain how it is. So it's okay to have negative feelings for your father, and it's okay to
Right.
even love him if he is hurting you or hurting your mother because ultimately he's your father.
Yeah.
So
Right.
any kind of feelings towards him is completely okay. And if this person needs help, I mean, if she needs help, there is definitely like individual sessions for people. I mean, there are a lot of therapists who also work in this direction, where because mostly, like we were discussing before, because of such people who don't take help or who don't change themselves, a lot of us need to go into therapy to understand कि ठीक है मैं
Yeah.
इनके साथ कैसे डील करूँ या मैं मेरी जिंदगी कैसे जीऊँ. So
Like they are not even the listeners ना. अगर उसको problem है, he is the kid of her own father.
yeah,
So this person is supposed to talk, share.
yeah,
अगर वही वहां पर comfort नहीं है, so you'll obviously look like कोई सुनने वाला तो मिल जाए यार. And there are these people like you who takes therapies and who listens more basically. So we basically want a listener. So if such questions when I get across, no, I just feel like there is no peace in the house. Just to find a peace, you need to go outside the house and find such people in the form of friends or maybe a psychiatrist who can just listen to you and tell you like, okay, just have to accept what is happening and be cool with it. Like, ठीक है, होता है ऐसे, बहुत बार होता है. Just to
no,
feel, make them feel like okay with it.
it's not completely like that.
Yeah,
Because a lot of times situations where there are personality disorders or any kind of not disorders but एक type की personality involved है जो बहुत ही dominating है, सुनते नहीं है किसी का.
yeah,
A lot of male parents, father figures in the house are like that. What we need to do is we need to change our reaction to the
yeah,
situation. जब for example families who have interpersonal problems, आप देखोगे एक ही टाइप का सीन चलता रहता है. यानी the dialogues will be the same every day. The same thing will happen,
yeah.
and the other person is going to react in the same manner. what we need to work on is how you perceive their actions, how to first
Yeah.
not take them personally, second how to change your reaction to their problem. क्योंकि एक्सेप्ट करना भी चीजों को इतना इजी नहीं होता. आप एक्सेप्ट एक हद तक ही कर सकते हो, बट वट एवर इट इज यू डू हैव एक्सपेक्टेशंस. आप कितना भी
Right.
आप बोलो कि मैं कोई एक्सपेक्टेशन नहीं रखना चाहिए अपन ने, वो ह्यूमनली पॉसिबल नहीं है. आप किसी ना किसी से कभी ना कुछ तो एक्सपेक्ट करते हैं.
Yeah. Right.
सो तो वो एक ऐसी चीज है जहाँ पे बेसिकली इन थेरेपी we learn all these coping mechanisms, we learn how to change our behavior, or we not change our behavior but change our reaction. So there are different
Yeah.
modalities known as, one is cognitive behavioral therapy, where we understand about how to react in different situations, or what happens, how our thought is working, how to challenge your thoughts, how to change them, how to work through them. Then there is a behavioral therapy, which is known as REBT, where we go through the normal things in life. For example, there are people who get really frustrated because बारिश हो रही है, बहुत बारिश हो रही है, पूरा दिन खराब हो गया, ट्रैफिक जैम में फंस गए, then they're getting mad at the traffic. They're getting mad at things which they don't have control over.
Yeah.
So to even learn this, I mean, for a lot of people, this sounds कि कितना बच्चों वाली बात है ये. I mean, this is something that you should know. But I'm really sure
Yeah.
if we sit down together, there will be a lot of things that I don't know and you also don't know. So we are
Yeah.
going
Right.
to basically, we learn. And ये सब चीजें ह्यूमन बिहेवियर और ह्यूमन साइकोलॉजी की ऐसी बहुत सारी चीजें हैं. इफ वी एक्चुअली स्टार्ट टू अंडरस्टैंड देम एंड अप्लाई देम इन अ गुड वे, उसका रिजल्ट बहुत अच्छे से मिलता है. So I have had patients with, I mean, traumatic household situations where they have happily accepted or changed how they work. So
Yeah.
mostly these people don't live together, but whenever these people meet, they will have a normal family conversations which they might not have had years ago, because they have changed their response and their reaction rate and how basically they do their things. So then a lot of these things go when you are into therapy and when you are into all of these. I mean, whenever you are taking consultation or counseling sessions with a therapist. So these are all the things that we discuss and that we do.
Okay. So while this session was going on, I got a question again from Kapila itself.
Hmm.
Okay. So she's saying like, but don't we fall for guys like them? The toxicity that the word, the things that you mentioned under that question, no? Why and how do we stop it?
We need to recognize that what are the toxic traits that you are falling for. Right. There are certain
Right.
things that we basically romanticize unknowingly or subconsciously, and we do attract to people like our parents. I mean, that is very common thing to happen. But again, सारी चीजें होना important नहीं है. And again, there
Mhm.
has to be, nobody is going to be perfect. I mean, you're not never going to get a very ideal person without any history of abuse or any history of any mental distress or any problems. कोई ना कोई प्रॉब्लम तो होने ही वाला ही है. या तो हिस्ट्री होगा उनका कुछ, या उनका कोई कोई तो भी एक बिहेवियर होगा जो आपको पसंद नहीं आता, जो आपको पटता नहीं. Now you
Yeah.
need to make sure what your priorities are in that particular sector. For example, what kind of a partner do you seek? What are the qualities that you want in a partner? So when I ask this question to girls, they are like, "Ki-" I mean, they basically say that he should be good looking, he should be tall, he should be dominate. I mean, somebody who speaks their mind. He should be this. He should be earning a good amount of money. तो ये सारी मटेरियलिस्टिक चीजें हो जाती है.
Yeah.
सो वी सबसे पहले तो हम प्रायोरिटी अपनी खुद ही समझ नहीं पा रहे कि आपको अगर मटेरियलिस्टिक चीजें करनी है तो आपको मटेरियलिस्टिक बनना चाहिए, तो आपको ये इमोशनल और ये बाकी के जो पर्सनल एस्पेक्ट्स होते हैं ना, उसमें आपको कॉम्प्रोमाइज करना पड़ेगा.
Right.
सो कॉम्प्रोमाइज भी कितना करना पड़ रहा है उसका भी एक लेवल होता है कि आप कितना हद तक की कर सकते हो. आई एम नॉट आस्किंग कि completely go on for emotions and given everything and go marry somebody who has done nothing in their life just for
Yeah.
the love and just for all that. Nay, you need to find that balance between those people, those things. और आपको ही आपकी प्रायोरिटी बनानी पड़ेगी कि कौन सी ऐसी चीज है जो ठीक है, आई मैनेज, ये इतनी भी
Yeah.
बड़ी बात नहीं है. आई मीन इफ द पर्सन से योर पार्टनर इज मेसी, ठीक है, but your previous partner was not only messy but was also abusive. Now this partner is messy, and if you are okay with living with the messy person or pick up after him or him picking after you, because girls can also be messy, girls are not always
Yeah.
perfect and एकदम prim proper नहीं रहती हैं हमेशा. So even for guys, you need to make sure आप क्या basically seek कर रहे हो उस इंसान में. It should not be something which is very temporary. आपको
Yeah.
क्योंकि अगर if you are thinking of a long term partner, then you need to think in terms of long term priorities. If you're thinking of short term partner, तो आप short term priorities के जैसे कर सकते हैं. I mean, it is basically up to you what you are prioritizing और आपका perception क्या है उस relationship में से.
Right. Okay. So I'm sure like all of these questions were properly answered, guys. I
I
mean,
hope, yeah.
Kapila, you are there, right? I mean, I hope you are there and you are listening, and I'm sure like कुछ तो समझा ही होगा आज के सेशन में. इट वाज लाइक फ्री सेशन फ्रॉम अ साइकाइट्रिस्ट. ऐसा किसी को चांस नहीं मिलता है, गाइस.
Exactly.
this was really awesome. I really love this session. Okay,
Me
so
too,
I have
man.
a question like at the end of the session always. That is, uh, what kind of feedback you would love to give to this initiative that I have started, the Legit Talks?
Well, I have gone through your page, and I think it's very important to discuss all of the topics that you have been discussing, because we need to basically start conversations around topics we hesitate to talk about
Yeah,
or are not talked about often, or things that we shy to talk about, or we feel that this is not important but it actually affects our life in a very major scale, but we don't realize that.
yeah,
So,
right.
and I love podcasts. I mean, that's one thing that I do on YouTube or on Spotify or on my phone. I love listening to podcasts because it basically, it generates questions. It makes you
Yeah,
question things. It makes you to think about things. It makes your vision wider. कि, okay, ऐसा भी हो सकता है. So
yeah.
for me, I am still learning. I am a very newbie psychiatrist, so I have a lot of things to learn. And for example, in psychiatry, we think from all dimensions. It's just not the health factor which is involved, just not the brain anomalies involved. We need to think about environmental, cultural, interpersonal problems,
Yeah.
everything all together. So biosocial, psycho stages, everything is very important. So these type of podcasts basically help to talk about these questions, which ultimately affect our lives. It is basically doing that. And I think that this is a really great initiative that you are doing.
Amazing, amazing. I just loved it, and I hope, guys, if you have some more questions, if you really want to talk to her, you can text her. She'll help you
Absolutely.
some or the other way. If you really want a session, also, she can guide you where she is, and with her contact details and everything, you can directly go at her place and get a session for yourself. And please tell me, like, how do you plan for sessions? Yeah, Pritisha, like, what is the routine in that? I mean, do you
So,
have a consultant fees or like directly session happens or something like that? Just tell me. People can
so
directly.
So first thing, I have a link on my page to ask me questions anonymously. I answer those questions every Sunday. So if anybody has just a question, they just are hesitant to answer, I mean, ask a professional doctor about that kind of question. So you can just go there and ask a question.
Okay.
And for sessions, basically from Instagram, what I do is anybody who needs a therapy or a consultation, they DM me first. I ask them to mail their details on my mail ID. I give them all the details of the session. So basically, there is either consultation or counseling, or consultation and counseling both. So what I do is I ask the patients ki at least first session with me or first consultation with me needs to be of either half an hour or 1 hour for me to understand the entire history, to understand what exactly is the issue, because I do not give medications to everybody. It's only if
Yeah,
it
yeah,
is needed. For example, depression. Just say nowadays there are a lot of articles coming up that serotonin doesn't cause depression. We already knew that serotonin doesn't cause
yeah,
depression. It is something which we have seen that serotonin जब कम होता है शरीर में या brain में तब depressive symptoms रहते हैं. It is one
yeah,
of the causes. It's one of the things that we are like focusing on. So there are different aspects. So at least first session needs to be of an hour, and then
yeah,
accordingly, either you need a consultation that if you are put on medications directly, which is something only happens in very, very, very severe cases. Say people who have psychotic symptoms, hallucinations, delusions, or a serious or a history of suicidal ideation, suicidal attempt. So these people usually, I recommend them if they are ready for medication that at least a short-term treatment we need, and we'll see how it goes.
yeah.
So that's about it, and that's how it goes. So after first session,
Amazing.
we decide if you need to get into full-fledged counseling and therapy with medication or without medication, and that's how it is.
Okay, guys, I'm sure like you come to know like what is the procedure. Basically, you can directly ask her if you have
Yeah,
again more questions. She is there on Sunday, even if it's her holiday, the only holiday she gets. She's free for you guys. Whatever questions you have, please freely ask. And thank you so much, Pritisha. This
thank you
was
so much,
really,
Zoe, for having me.
really great. It was like I don't know. This is my first session with a psychiatrist, and I have been doing certain sessions where it was all professional, but this is like profession plus totally attached to your own life. The way you do things, the way you talk, the way you behave, it's all connected to here. And this is what you have been telling. Like there are questions which have actually opened my eyes and other people's eyes too.
I'm glad to
I
do
hope
that.
that we can have one more session, maybe a
Absolutely.
combined one.
I
Another
will love it.
psychiatrist would come in the show and like have a talk with you, and I'll be the mediator asking questions to
Yes.
both of you. This would be
Yes.
something different and amazing, I guess.
I will absolutely love doing that.
Thank you so much, Pratisha, for your golden hours. This
Thank you
was
so
really
much.
amazing. See you next time for sure.
Absolutely. Bye. Thank you
Bye.
so much.
Most welcome. Thank you guys for sticking up, and I hope this was an eye opener for you guys also, as it was for me. I'm sure, like, if you still have questions, she is going to help you out in some or the other way. Still, if you really feel that you need to have a session for your own brain wiring, you can directly ask her. She's totally based in Nagpur right now. If you need anything, you can directly ask her. Again, thank you so much for always supporting me like this, asking questions in the comments while talking. And this was like really a great session. I'm happy that I did this today. I'm going to come with an amazing story the next time. I don't know when and what time. It's going to be random, I hope. And you guys again still be there just like this. Thank you so much, guys, for watching. See you next time. Bye. Namaste.